Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, Ida Klein. It's Thursday, September 25th. On today's HITshow, Tampa General earns a first of its kind National Innovation Award. Temple Health braces for a strike by more than 2,500 workers. And One Medical moves into menopause care, pushing the competitive line for women's health. Later, we'll look at a merger in workflow tech, a new bill that could speed up Medicare Advantage payments and research linking price markups with patient outcomes. Let's get started. We begin in Florida, where Tampa General Hospital has made history. Nate Collier reports.
Thanks, Ida. Tampa General has become the very first recipient of the Joint Commission's new Innovation Award. The honor recognizes hospitals advancing care through transformative use of technology. TGH was cited for its predictive sepsis tools and data partnerships with Palantir, among other AI-driven initiatives. The Joint Commission noted that Tampa General not only deployed these tools system-wide, but also integrated them into daily clinical workflows, cutting response times and reducing adverse outcomes. This inaugural award is expected to become an annual benchmark, with hospitals nationwide looking to match the example TGH set, combining innovation with measurable gains in safety and quality.
Nate, that's a powerful recognition. And being the first recipient really puts a spotlight on their leadership role. Thanks for that. From Florida to Philadelphia, where labor tensions are climbing, Teresa Vaughn has the story.
Yes, Ida. More than 2,600 workers at Temple Health are preparing to strike after contract talks stalled. The union represents nurses, technicians, and support staff across the system. The main sticking points are staffing ratios and wages, with union leaders saying the hospital is asking too much of too few workers. Temple officials say they remain committed to reaching an agreement, but are also activating contingency plans to keep operations running. For patients and nearby hospitals, the ripple effects could be significant. Temple serves a high-acuity population, and any disruption in services may shift volumes to neighboring facilities.
That's one to watch closely. A strike on that scale would really test care continuity in Philadelphia. Thanks, Teresa. And when we come back, we'll look at how One Medical is positioning itself in women's health, taking direct aim at a growing market.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
Welcome back. One Medical has just expanded into menopause care. Jade Romero joins us with the details.
Thank you, Ida. One Medical's expansion signals just how competitive women's health is becoming in primary care. The service will be offered nationwide, covering perimenopause, menopause, and midlife health management. Why does this matter? Because it puts One Medical squarely in competition with specialized providers like Meaty Health, one of the fastest-growing virtual women's health companies, which recently secured major venture funding. Meaty and similar startups have been working to destigmatize menopause care and bring evidence-based options directly to patients. By moving into this space, One Medical is betting that it can leverage its Amazon-backed scale to integrate menopause care into routine primary care, potentially at lower cost to employers. That creates pressure on health systems and OB-GYN practices to expand their own midlife women's health offerings.
Jade, that is a sharp move by One Medical, and the competition you mentioned really underscores the scale of this market shift. Thanks for that context. From women's health to operations technology, Peter Betterworth has the details on a new merger.
Ida, real-time location system provider Sonitor is merging with workflow intelligence firm Tagnos. The combined company aims to link asset tracking, patient flow, and staff safety into a single platform. Hospitals are already looking at RTLS for equipment management and staff duress alerts. By adding workflow overlays, the merger could push ROI beyond logistics, helping hospitals streamline throughput, reduce patient wait times, and even monitor compliance with safety protocols. It's another sign of consolidation in the health IT ecosystem, as niche solutions combine to offer more integrated value propositions to hospitals.
That is an interesting development, Peter, especially as hospitals demand clearer returns on technology investment. Coming up, two big policy and finance stories. One on faster Medicare Advantage payments, and another tying price markups directly to patient outcomes.
HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.
Welcome back. You're listening to HITshow. Now let's turn to the policy front. On Capitol Hill, a bipartisan bill could ease one of hospitals' biggest frustrations. Anika Shah reports.
That's right, Ida. The new prompt pay legislation would require Medicare Advantage plans to pay 95% of clean claims within 14 days for electronic submissions and 30 days for paper or out-of-network claims. Hospitals have long complained that MA plans delay payments, straining revenue cycles. For providers already dealing with rising labor and supply costs, faster payments could mean real relief in cash flow. Insurers argue that the timelines may be too aggressive and could raise administrative costs. But with bipartisan sponsors and strong hospital backing, this bill is one to watch.
It could be a game changer if it makes it through. Hospitals will be pressing hard for this. Thanks, Anika. Finally today, a study connecting pricing practices with patient outcomes. Logan Stokes has more.
Ida, new research shows hospitals charging the highest markups on elective surgeries actually had worse patient outcomes than their peers. Published in JAMA, the study analyzed thousands of cases across multiple specialties. The findings add weight to arguments from payers and policymakers that excessive markups aren't just a financial issue, they may also correlate with quality gaps. For employers and insurers, this could accelerate the shift toward reference-based pricing or steerage to lower-cost providers. And for hospitals, the scrutiny is likely to intensify. Boards and CFOs will need to explain not only their price strategy, but also how it relates to outcomes and value.
That's a tough spotlight, Logan. This could really influence negotiations and public perception. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Dr. First. Optimize medication management with integrated workflows that make every step of the patient journey easier. Dr. First empowers providers and their patients to achieve better health. That's Dr. First.